Good morning or afternoon, everybody. Today I'm going to be talking to you about my study that I've been working on the last 2 years called The General Knowledge of Nutrition, a demographic study of NCAA athletes. A little bit of rationale behind why I decided to study this. I'm an athlete here on campus, and it has been noticed that practice times for athletes are around meal times, which causes athletes to not be able to eat at the right times of day. And since athletes do not have time to eat the meals that they should be eating between their practice, class schedules, lifting, and film sessions, athletes eat food before their practices that often make them feel sick and sluggish during their practice time. And since athletes need food to fuel their bodies, I was curious to know what kind of general nutrition knowledge that athletes hold. I came up with 2 research questions and 1 hypothesis. The first is, to what extent do men and women differ in nutritional knowledge? The second is, what is the effect of an athlete's involvement in a particular sport on their nutritional knowledge? And my hypothesis is athletes having a prior nutrition class will have more general knowledge of nutrition than athletes who have not. A little bit of supporting literature. An athlete's nutrition and maintenance of health is directly related to the athlete's well-being. There's evidence that athlete nutrition knowledge is poor among the athlete population, and athletes get their nutritional information from various sources such as gym owners, magazines, coaches, food store personnel, and other athletes, which it's important to note here that none of these sources are health professionals, which could explain the results that we will find out. For my methodology, the procedure was to give out about a 10-minute survey to NCAA student athletes all attending Robert Morris University. It was a survey developed by Paramental and Worrell from the United Kingdom, and it is called the General Knowledge of Nutrition Questionnaire with added demographic questions that I came up with. The surveys were handed out mostly at the beginning of athletes' lifting sessions by lifting coaches Todd Hammer or Jeremy Boy. The total nutrition knowledge score could have scored 107, and it's broken down into 4 different constructs. Dietary recommendations with a max score of 11, sources of nutrients with a max score of 69, choosing everyday foods with a max score of 10, and diet-disease relationship with a max score of 17. The sample was 170 different Division I student athletes, all from Robert Morris. 8 sports were tested with 12 different teams. Giving a little bit of overview to the descriptive statistics, these are all the mean scores of the athletes in each subconstruct I looked into. The dietary recommendations, the mean score was a 6.5. For source of nutrients, the mean score was a 39.2. For choosing everyday foods, the mean score was a 4.2. For diet-disease relationship, the mean score was a 5.96, and the overall nutrition score was a 55.9083 out of 107. It's a pretty low score. So we'll look at each of the research questions and the hypothesis for all of those subconstructs. To what extent do men and women differ in nutritional knowledge? For dietary recommendations, this was not statistically significant with a p-value of 0.119. To what extent do men and women differ in nutritional knowledge in terms of source of nutrients was also not statistically significant with a p-value of 0.615. In terms of choosing everyday foods, this was statistically significant with a p-value of 0.020. In terms of the diet-disease relationship, it was not statistically significant with a p-value of 0.161. And the overall total nutrition score was also not statistically significant with a p-value of 0.312. So you can see that there's not a huge difference between women and men's nutritional knowledge, but it is important to note that women scored higher in every single category. For research question number 2, what is the effect of an athlete's involvement in a particular sport on their nutritional knowledge? This was statistically significant at a 0.1 level with a p-value of 0.078. You can see here that soccer scored the highest with a mean score of 7, and football scored the lowest with a mean score of 5.73. In terms of source of nutrients, this was not statistically significant with a p-value of 0.230. You can see that softball scored the highest with a mean score of 46, and basketball scored the lowest with a 36.78. Choosing everyday foods was statistically significant with a p-value of 0.031. Basketball scored the highest in this section with a 4.9, and football scored the lowest with a mean score of In terms of diet-disease relationship, this was not statistically significant with a p-value of 0.332, with softball scoring the highest with a mean score of 8, and cross country and track and field scoring the lowest with a 4.86 mean score. For the overall total nutrition score, this was just hardly statistically significant at 8.1 value with a p-value of 0.099. Softball scoring the highest with a mean total nutrition score of 64, and football the lowest with a 52.7. Looking at the hypothesis, athletes having a prior nutrition class will have more general knowledge of nutrition than athletes who have not. For dietary recommendations, this was statistically significant with a p-value of 0.002. In terms of source of nutrients, this was not statistically significant with a p-value of 0.144. Choosing everyday foods was not statistically significant with a p-value of 0.818. The diet-disease relationship was statistically significant with a p-value of 0.005. And the overall total nutrition score was statistically significant with a p-value of 0.027. Looking at my first study, I split my thesis into two different studies. I realized that athletes really do not hold very much nutrition knowledge at all with a mean score of 55 out of 107. So I wanted to create a second study to test the knowledge of the athletic trainers, the coaches, and the strength and conditioning staff at RMU's campus. The procedure had the same measures and the same procedure for the second study as for the first study. The sample description was 15 participants from the RMU athletic department, 5 coaches, 5 athletic trainers, and 5 strength and conditioning staff took the survey. The descriptive statistics, the left column shows again the max possible score that you could score, and the mean scores on the right. You can see that the overall nutrition score was a 68.1818, which was higher, but not by a huge amount. For the dietary recommendations, we can see that the athletic trainers scored the highest mean score, followed by the strength and conditioning staff and the coaches scored the same, with a total mean score of 7.4667. In the source of nutrients, the athletic trainers also scored the highest again, followed by the strength and conditioning staff and then the coaching staff. The total mean score was a 47. In choosing everyday foods, the athletic trainers scored the highest once again, followed by the strength and conditioning staff and then the coaching staff, with a mean score of 5.3571. In the diet-disease relationship, once again it followed the same suit as athletic trainers scoring the highest, followed by strength and conditioning staff and then the coaching staff. The mean score was an 8.6. And for the total nutrition score, again, the athletic trainers scored the highest, followed by the strength and conditioning staff and the coaching staff. The mean score was at 68.1818. And it's important to note that none of these were statistically significant because the amount of people that we were able to survey was not high enough. Going into the recommendations, while the athletic department at Robert Morris did have score over 10 points higher in their mean scores than the athletes did, I still would not consider 68 an adequate nutritional knowledge score out of 107. So in order for our athletes to perform at their optimal level that they're capable of, they need to be fueling their bodies correctly, and a nutritionist should be hired on RMU's campus to increase the amount of nutritional knowledge that these athletes are getting. The athletic trainers, coaches, and the strength and conditioning staff should also be involved with their some sort of nutritional training as well in classes, because they do not have the adequate knowledge to be giving their athletes advice, which they are doing right now. Thank you. Are there any questions?
We will hold the questions until